you are here to talk about mainly about this one event that you're organizing, which is the CoWinCon, right? So this CoWinCon is basically, as you say, it's for the people by the people, right? So could you tell us a little more on what this conference is and what exactly is it that the audience can expect out of it?
Absolutely. Technically, I thought about this even last year. We had a small webinar that we had organized to kind of, because, at that time COVID was, new, and we were
Correct.
kind of flustered about the new normal and how it works. So at that time, I had hosted a webinar. But now the situation has changed. It's a long-term event, that we are looking at. And I started this, or I got the idea for this because my family tested positive.
Right.
And at that time, I was bombarded with a lot of information. I was overwhelmed and panicking because I did not know what was right, whether, it was needed, not needed, because at that time there were CT scans and, medicines that we need to take care of. So all of these things were a lot of information. And at that point, I did not know which were true, or, I did not know which to kind of reject. So at that time, I thought, people need to know all these information, and that was one of the main reasons why, I wanted to do this. And in this, I basically have a medical, biomedical, physical, and mental health panel that we have. These are all experts who have worked with, individuals with COVID, or either they have experience in this field. So, for example, in the medical panel, we have a medical resident who had handled the COVID ward.
Right.
So, he'd be sharing personal experiences and also about self-medication. And even you had done a recent session on plasma therapy, right?
Correct.
So, so basically, we are going to talk about all these things and try to kind of give reliable information on what and how it works. And with respect to my biomedical panel, we have a researcher who has the patent for the manufacturing process of AstraZeneca. So because, as of now, we don't have a lot of vaccines.
Right.
So we want to know, what is the reason? Like, was this a hurried process? And, people have their questions. Even if
Right.
there are vaccines available in the US, people did not take the vaccine. So we want to talk about those. And in the mental health panel, we have individuals who were at the hospital
Right.
working with clients in rehabilitation, and also individuals who are taking individual clients, clinical psychologists. And same way in the physical panel, we have an expert who has worked with online sessions
Right.
during this past year, and also on breathing techniques and basically hygiene. So all of these things we'll be talking about.
Right. Rajeshwari, I'm sorry to disturb you, but your fan is sort of making noise. So could you just turn that off or reduce your fan?
Oh, all right, I can
Yeah.
do that.
Yeah.
Just give me one second.
Sure, no problem. Everyone who's watching, thank you for joining. I hope you guys are doing well, and I hope you guys are enjoying your week. And we are seeing sort of a the the bad parts going and the good parts coming now in India. So hopefully things get better soon. Rajeshwari, coming back to the conversation itself. So. The whole reason you're doing this conference is to sort of make people aware uh, of of what the situation is, not just the situation, but how you can actually deal with it mentally as well as physically. So you're covering both aspects during this particular conference. So right now we will be diving a little deep into the therapy part of it, which you do your research on, which you are doing your PhD on. So first of all, I want to ask you as to why, who needs therapy. So how does one understand if they need therapy or not?
All right, that's actually a really good question, because often, people do not know, when and do I need therapy and all of these. So everyone can go for therapy, or for counseling. It's not I need to have a problem to actually go for therapy. I can even go for, skill improvement, like for example, assertiveness, problem solving. So to kind of build all these skills, you can still go for personality and skill development aspects of counseling. And there are also aspects wherein in your family dynamic or in your relationship dynamics you have issues, you go for family therapy and marital therapy. And you don't need to have a major issue like like how they show in movies and all of that,
Mhm.
a major communication issue or a
Yeah.
major nervous breakdown before you actually go for therapy. It can be kind of a precaution or kind of a um, you can take it as a preventive measure as well. So if you think you would like to experience, I personally think that everyone should experience it
Mhm.
because it's a very, very, introspective experience.
Right.
You get to share your life, your details with someone who is, going to be receptive to that,
Mhm.
and also to kind of introspect with a dialogue,
Right.
instead of just sitting with and introspecting. There's nothing wrong with that, but still. So, in general, we all have a lot of coping mechanisms in our lives.
Mhm.
Like, for example, you talk to friends, or
Mhm.
you paint, you do any kind of expressive art. So, all of these things are, you know, uh, coping skills or decision making skills, problem solving skills, which we learn from various aspects, our parents or whoever.
Right.
So uh, after a point, you might want to change those patterns, or you might want to explore other forms of coping skills. Uh, in the sense that even like, for example, take the COVID times.
Yeah.
So you are spending a lot of time with your family, or you are by yourself, and
Mhm.
you want to explore other coping mechanisms because what usually works doesn't work now,
Right.
right? So uh, these are all times for trying to understand or go for just a session. Just
Mhm.
even a single session can change a lot about what therapy is like, and can remove especially the taboo around mental health and mental illness, because
Right.
yeah, these are two different things actually. I want to
Mhm.
rephrase that: mental health and mental illness. So
Right.
both of these things we want to focus on in therapy. And there is nowadays counseling and therapy in a lot of different fields. Like you have sports and you have corporates, even in hospitals before surgeries. You
Mhm.
know, people can go for sessions because if your blood sugar or sorry, if your blood pressure is high, then it might lead to complications. So to kind of reduce that stress, people go for like a couple of sessions before their surgery. So all of these things are common practices abroad, and now in India we can see a rise in this.
I think you brought in a fair point of it being common in abroad, right? Because in between you mentioned about family therapy and couples therapy. That's not something that we usually hear in India or in Indian families, right? I don't think
Yeah.
I don't think I've ever heard any family. Of course, these are personal matters, but then even in my close families, I've never heard of anyone actually talk about family therapy, right? So.
Absolutely.
What I want to understand from you is what exactly happens during therapy. Because when you talk about therapy, it's more like what I understand is that therapy is more about getting my stress out or getting sort of having that knots in my head removed, right? Whatever sort of
True.
complications I'm feeling or whatever stress I'm dealing with, right? But then I also feel like these sort of conversations having with a stranger is something that is very difficult to have. You being able to open up with a stranger is very difficult. Rather, I would go to a close friend, right? I would want to go to a close friend and talk to them about what I'm dealing with. Whether they are able to give me some advice or not, it's just that I'm able to communicate to someone and someone is able to either relate to it or understand my problem. So how does therapy really work, and how do what role does therapist play in this?
Very, very understandable, because we come from a very, like, culturally, we are a very, interdependent culture. So we do rely a lot upon our parents, our elders, because, our family itself is like, oh, you have a problem, after marriage, it will be fine. Like marriage is like a fixer for us. And also, when someone has a problem, they say, okay, go and ask the elders. They'll be able to give you advice. So all of these things are good forms of coping, or it's going to help you hone your skills, definitely. And sometimes these are the social supports that you need.
Mhm.
All right. And but it is a common misconception that it's very easy to talk to friends but not easy to talk to strangers, because um, like as psychologists, we ourselves are supposed to resolve our issues. So we do go through therapy,
Right.
right? So yeah, so even I have experience from my side. We were supposed to do it as a part of our master's
Oh,
course.
yeah.
So in that, I realized that it really helped me connect and to kind of talk it out to someone really helped because it was a stranger. It helped because to my friend, I'll be like, oh, what if tomorrow she brings this up, or what if he doesn't, he doesn't feel the same way after I, say these things. So it is much easier to connect to a therapist if you find the right one. And
Right.
yeah, and I also want to kind of mention that uh, with respect to who you asked me like who needs therapy. So I also want to talk about when people need therapy. So basically, whenever you think that you need it, you can take it. So basically, you need help, you ask help. That's the main point. And because in some cases, actually, with respect to addiction, or in a lot of cases where the individual is not in touch with their reality, then a parent or a family member or friend brings them to the clinic. So during other times, we have a lot of clients voluntarily coming up with a lot of these issues and trying to, talk it out. And uh, usually people come for therapy when they realize that their issues or problems, even however small or big it is spilling over to other parts of their life, which is their work life, their social life. You
Right.
realize that you're snapping a lot at your friends, or you realize that you're taking a lot of leave, you're not motivated, especially during these times. There's like a work from home burnout. So these are times during which therapy can really help you out in understanding. And you rightly said, like, about talking to friends and family because they are going to give us advice. But in therapy, the more common misconception again is that we get advice from our therapist, which is not true because it's going to be a dialogue. We both are going to solve that together or
Right.
attempt to resolve that. And mainly the therapist is going to be like a guide, just going to help them in the process. So that's the role that they play. And
Right. Okay.
yeah, so basically it's about uh, when people need therapy, it's about their subjective experiences and their perceived stress. We use these terms subjectives and personality because it's going to differ for a lot of individuals. And I cannot say like saying, oh, if you have a burnout, then you need to go for therapy. I
Yep.
cannot say that because some people have a better, social support system or, better ways of coping. So in that case, they might not need therapy.
Right.
So it's about what you perceive. And whenever you think, even for a second, that someone else might be able to help, then you go ahead.
Right. But then, like, one thing that comes to me when you talk about this is that, uh, suppose, for example, I think that I want therapy right now, right? But for that whole process to start, like, of course, looking for a good therapist is a whole thing that I want to come to at a later point. But then, more than that, once I find a therapist, I need to sort of be able to open up to her. I need to get comfortable with him or her. I'm sorry. I need to be comfortable with him or her, right? I need to be able to sort of figure out if what that person who I'm talking to, whether they are able to understand what I'm even saying, because that is also going to be a long process. So how does someone deal with that? Like, if suppose, for example, I start therapy right now, what does it take for me to be able to sort of make something out of that therapy? It's not like the first session, or the I don't at least I don't think, because I personally haven't experienced therapy, so I don't know much about it. So for say for the first 2 to 3 session, as I imagine, wouldn't be that helpful, because that would be the time when it would be like for the therapist to realize what sort of a person I am, or what I really need. And then from the third or the fourth session is when things really kick off, right? So, am I right in the way I'm thinking, or is it different?
So I'm just like noting down because I think that is a two-part question.
Right.
So basically, first one is how do you know that this particular therapist is working for you? Um, just like how sometimes you go to a doctor and you're like, I don't think he's right for me, doesn't understand, or he or she doesn't understand my problem or issue. So similarly, with a therapist also, if you go for like therapy once and then it doesn't work, doesn't mean that therapy doesn't work or counseling doesn't work.
Right.
It means that probably that particular mental health professional and you did not match
Right.
your expectations or whatever. So usually people go with education first. They should be qualified. They have either a proper clinical or counseling psychology master's degree, after which there are psychologists. I think we discussed that in our previous live. And after that, you have a clinical psychologist who's there, and there are also different, sports psychologists,
Right.
rehabilitative, psychologists, or in corporate, especially people who are specializing in those fields. So you have a lot of specializations which you need to go do your research and get to know your therapist. So a lot of research needs to go from your side to actually figure out which therapist to go for. Right? So usually people have their websites and these days Instagram pages, a lot of them, and they work out wonderful. And these days it's a lot about information, what you can ask your therapist. So you can ask them for their qualifications, you can ask them which is their demographic, who have they worked with. Because, for example, if I'm from a minority, be it an LGBT community or if it's going to be a caste-based minority, whatever it is, if you know that the therapist has worked with that area or has experiences, then they'll be able to more relate to that. So you can ask them that very directly. And also, it depends on age, gender.
Right.
If you think that a female therapist would be, a better fit for you, then you'll go for that. Or if you think a younger one, even though, they are because of some demographic features, you think, oh, they are more similar to me, they'll be able to understand. You can go for it. I'm not saying that because you have selected them, this particular thing, even after so much, research has to work out. You
Yeah.
must still, have your experience with that. And a lot of times what people do is they don't communicate with their therapist that this is not working.
Right.
Right? So you can always tell your therapist saying, listen, I think that you have taken it the wrong way. I am more spiritual in nature and you seem to reject my values and my beliefs. Therefore, this is not working. And if the therapist thinks at any point that this is not working or their value systems are not matching, they can always try to understand,
Right.
communicate, or even refer them to another therapist if they think that their area of expertise is not really aligning with yours. And another major one is the school of thought. A lot of therapists can take up different schools of thought. For example, if I'm a very cognitively oriented person, meaning if everything is structured, like this is the cause, this is the consequence, then I can easily understand my problem and try and work with it. However, for someone who is more emotionally going about the issue, might not like this structure. So in those cases, maybe they might go for more, social perspectives rather than a cognitive behavioral perspective. So all of these different perspectives, you can talk it out to your therapist and try and, kind of understand that. And moving on to the second part, as you said, the first few sessions, it is mostly going to be just case history,
Okay.
we call, which is basically just trying to understand what are the issues and what's happening, what are your goals. If it is going to be some brief personality improvement or skill development kind of a case, the client usually comes with a goal. Right?
Right.
And if it is, there are briefer therapies, like for example, crisis management, suicide interventions are all very, very brief. So in those cases, the goal is very specific. You attain that, you're done. But in the case of a long-term therapy, then in that case, your expectations are going to be that in the first few sessions, you're going to get to know each other, build a rapport, and during that time, surprisingly, you get to know a lot.
Okay.
And you'll get to know saying whether this is going to work out or not. So the first few sessions are very important for the therapist as well as the client to kind of understand.
Right. So what I understand is therapy is not about you getting a solution as such, but it's more about you sort of understanding it yourself via some sort of direction that the therapist is giving you. Am I correct in what I'm thinking?
Yeah.
Yeah. So even when it comes to like picking a therapist, right? Like you said, there are various therapists that we can pick from, or we need to sort of have an interaction with the therapist to figure out if that therapist is actually right for me or not. But who, how does that system really work? Like, in the sense that what is the process that it takes for me to be able to find out who my therapist is, or who my long-term person is going to be, who I'm going to talk to. Do I, for example, in a more practical manner is what I'm asking you. For example, if I take say three therapy sessions, and then I realize that okay, I don't really want to continue with this person, I will go with another one, right? But then the other person itself, also I have the same situation, right? I'm not able to sort of mingle with that person, or I'm not able to understand what that person is saying. So where do we draw the line as to okay, maybe the problem is with me in terms of understanding if the therapist is doing the right thing or not? Or is it right for me to think that okay, maybe therapy is not the solution to this?
All right. So usually in the cases of a lot of severe, moderate to severe issues, there might be a lot happening with the person.
Mm-hmm.
So during those cases, what happens is they usually are referred to a psychiatrist, and they go through some, medical treatment before they
Okay.
actually start therapy, to kind of, if they are really having issues with their moods, or, with their sense of reality or sense of self, then they tend to take medications first, and
Okay.
then therapy comes along. So that's the process with moderate to severe usually. And what happens is people go to clinics or any mental health organizations, hospitals, mental health hospitals basically. So that's where they find who, fits them the best. And these days, I see a lot of clinics coming up, and a lot of them are very open to when you just call them and ask them. And they also have a lot of client reviews. And one thing, like how you get a doctor reference, you ask someone like saying, hey, who's your family doctor? Similarly, like have you experienced therapy? Do you know anyone? And that works. And being from a mental health circle, I know that if someone is going to ask me, because during these COVID 1.5 years, I
Mm-hmm.
have had a lot of individuals coming and asking me, can you do therapy for me? And I'm like, no, I don't
Okay.
practice right now. So I suggest them, I refer them to a lot of my friends and acquaintances who are really good in that particular field.
Okay.
And that's how the direction goes. When you tell them saying, this is not working, do you think that someone with these particular qualifications or these particular things I need is available in your circle? Can you refer me to them? And they usually do that. And one thing which I really want to reiterate here is during the first few sessions,
Mhm.
sometimes the client, because they are just starting to talk to someone, they kind of have a verbal diarrhea
Right.
over their story about what's happening. So what they tend to do is they blurt out everything like, oh, these are my issues, this is happening. And then the second session, they're like, I just told them everything. I am, you can be embarrassed or ashamed or just nervous. So they usually don't show up for a second or third session.
Okay.
And this happens, trust me, very common. People do that. And therapists are okay with your verbal diarrhea. So it's completely all right. So that's something that I want to, I want people to know. Like it's okay to blurt out everything during a session. The therapist is not going to judge you.
Right. So now I want to change the subject a little bit, and this is something that we hadn't discussed earlier, but I want to still ask you this question. So
Mm-hmm.
basically, I had a live with last week as well with another therapist who spoke about how we can deal with stress and anxiety that we are getting during these times because of all the news and the works, schools, college, etc., right? But one question that I had asked her, and I want to understand what your perspective on this is as well, is how well do the basic sort of things that are promoted work. So what I'm saying is basically, on Instagram or any social media page, the main thing, when there are 5 to 6 different points which people focus on when they talk about dealing with stress, right? So people say you should meditate, you should exercise, you should sort of cut off from the internet or cut off from the news so that you can keep your mental health together. But then after listening to this same thing so many times, it just feels like it's something that is becoming more just of a theory thing than a practical thing, because I don't know if that is really going to help me with my stress. I like my personally exercise so that I sort of have some sort of clarity in my mind. But then I know friends who don't really think that exercise is helping them even after they have exercised, right? So what are your thoughts on that? Do the traditional I'm gonna call it traditional. I don't know if they are traditional, but do the traditional methods of coping with anxiety and coping with stress that are promoted really work, or is there anything more to what you're supposed to do with your stress?
All right. So this is, what you're saying is true, because therapy or counseling by itself is tailor-made, fit to a person's need, and that's how it's going to develop as the therapist and the client start interacting. That's how it goes. So what I want to mention here is it's all going to be subjective, a personal experience. So usually something that I do, which is not, what any therapist would tell you to do, or, is basically very similar lines how, your exercise works. So for me, I just start jumping.
You're right.
Whenever I'm anxious, and it works for me. So the main reason being I have a lot of, I'm just anxious and I start shaking. So what I do is I just start jumping, and then my energy just kind of comes down, and automatically I feel like, okay. So that's basically because for me, anxiety is a kind of a flight or fight response for me, because there is an imminent, danger. In this case, just, public speaking could be that. So what I do is I kind of try to, focus my energy on doing some other activity so that my body thinks that, the threat is okay, like I have spent my energy. So like that, the principle that you are working on, which is, just working out, it's the same principle, but we execute it in different ways. So similarly, for any issue, it's going to be, the fundamentals are going to be quite similar.
Mm-hmm.
So this is why, for example, with COVID, you have symptomatic treatments, right?
Yeah.
So even with the case of mental health, you can have symptomatic treatments that sometimes people go ahead, and sometimes a lot of therapists do give, because then the client also feels like, okay, for me, these particular things or therapy is working. And even the mental health professional gets to deal with the symptoms a little before they delve into the root of the problem.
Right.
So normal ways or traditional ways of dealing with stress does work for some people, no matter, whatever different kinds or varieties of that you're going to execute it in. So punching into a pillow when you're angry, or, just starting to scratch papers or cleaning the floor, whatever it is, it still works, because, it's the same logic, just physically exerting your energy, just emotionally venting. So it might not on a long run work, and you might have to seek other coping mechanisms. And that is true for all kinds of, issues, whatever problems that you're facing. And usually, especially with emotions, I'd like to mention that it follows a bell curve kind of, so you have the emotion starting, and then it reaches a peak, and then it comes down. So that is usually the case with a lot of emotions.
Okay.
Not when, there is a threat which is present or it is imminent, like COVID. In that case, you are just at the peak, and then your body and your mental health resources, like mental resources, get depleted, and the stressor is still there. So in those cases, it's going to be different. But when you have like an imminent or a general emotional reaction, that's how your emotion goes.
Mm-hmm.
So so either way, your emotion is going to come down at one point or the other. So that is why a lot of traditional, ways work.
Right. So what I understand is basically if someone is going through some sort of stress and they want some sort of relief at that point, it's about physical or emotional exertion, however you do it. Whether it's either like, I guess crying also works at that point, crying or screaming or something like that might also work. And in terms of physical activity, you can do what physical activity you're comfortable with, and that sort of exerts all the stress that you have inside you. Am I correct?
Yeah, so exertion is one way. So there are other ways of dealing also. Like, for example, you can just deny. Like, for example, I just stopped watching COVID-related news for a day. I just lived in denial, my own peace. It worked for me for a day, right? But continually, that is not going to be a very healthy way of coping. And in some other ways, it can be even sublimating my energy into something else, or my thoughts and my, into something else. So there are different ways of coping. Even just reading about it, like saying, I'm anxious, what do I do? Just reading other people's experiences vicariously, can also help. So
Okay.
there are different ways in which, so our traditional that we do is usually a form of, mental or physical exhaustion, but there are other coping mechanisms. When you go into therapy, you'll think like, oh, I do this on a normal basis. Like I write, I
Right.
write whenever, So all of these things are common. And even with respect to say any kind of, body related dysmorphia or anxiety, and you start posting pictures on, Facebook or Instagram, and someone hearts the picture, says, oh, very nice it is. And you get a sort of validation from that and you feel good.
Yeah.
So that is also, so then you start posting more pictures. So that's a way of coping as well with whatever issue it is. So we all have different types of coping mechanism and usually use more than one.
Okay, got it. So now coming to I think the most important part of this conversation, I would say the most important part, because I think this is one of the biggest reasons that people don't want to go to therapy. Of course, the whole idea of therapy in itself is sort of new, I could say, to India, to our country, to our society, because we haven't. This is not something that we are taught in school, or I guess this is not something that is promoted in our childhood, right? But then more than that, even if you make up your mind, okay, I want to go to a therapy, I want to find a good therapist for myself, then comes the point of the financial, financial position, right? Because what I understand is, per therapy is it can get quite expensive, especially if you are someone who needs a lot of therapy, right? It's not just that you can do with therapy either once a week or once a month. You might need it more than once a week itself. And usually therapists, if I'm not wrong, charge per session wise, right? So that sort of gets really expensive for someone. So how does someone overcome that? Is there any way to overcome that, or of course does it only depend on the financial position? Is yeah.
All right. So as you said, definitely therapy is a privilege. Counseling is a privilege. There are, therapists who charge 1,000 rupees per session, which is, kind of like an average rate at this point. And but there are some therapists who do pro bono work, or they give you discounts if you are a student, or if you tell them that, I really need therapy, but I'm not able to afford, or they will at least refer you to some individuals. And usually I can, to kind of, I'm not trying to justify this process, but I'm also trying to say that mental health or therapy is a lot of mental work for the therapist. So it's not just that they come there, sit and listen,
Right.
and then try and be like, oh yeah, how are you feeling? Okay, yeah, that's not how it works. Like, or they're not going to just read your mind. It requires a lot of, free work, trying to understand, being in that state. If the client is going to come up with, a lot of emotional work during that particular session, then I personally, as a therapist or a psychologist, have to deal with that. So usually a lot of therapists have supervisors and therapists. Those are usually two different people.
Okay.
So they also are under, a lot of steps that they also need to take.
Okay.
Because of all the background process, therapy invariably becomes expensive. The good thing is, fortunately, in our country, there are a lot of NGOs, government hospitals, where you can have your assessments done for free, or therapy sessions are, you get them at concession. So that is something with respect to the expenses. And also, because you mentioned about, therapy being a taboo, I really want to reiterate here that every individual who is going through, or is trying to understand what therapy is, if they have mild, moderate, or severe issues, whatever it is, their family members or they themselves can ask the psychologist, mental health professional to, psychoeducate them. So what I mean by psychoeducation is to kind of brief them about what the issue is, what is the prognosis, what are the steps they are going to take, and to kind of, in general, explore what the issue is about. So to educate the family, friends, or usually the family in India. So to kind of understand, because with respect to the person who has the issue as well, you need a social support system, because that's going to keep you from relapsing, or it's going to help you with the process of growth and healing. So, which is one of the major reasons why psychoeducation is necessary and people need to take that. And that, I think, personally reduces a lot of the taboo part. But yes, coming back to it, therapy is expensive, it's a privilege, and people can definitely seek certain NGOs which offer therapy. I cannot vouch for the quality though, because from my personal experience, uh, it doesn't usually have a very high quality, but then if it is a mild to moderate issue, it usually is resolved.
Right, right. I mean, that was going to be my next question in terms of what the quality of these free therapies or the pro bono therapies that are there are. Um, I think Rajeshwari has some internet issue. We'll just wait for a minute.
Oh yes, I just got lost. Just 1 minute.
Whoever's listening, I hope you guys are able to sort of understand what therapy is. That's the whole point of this conversation. And I hope you are also, if you are in need of therapy, or if you at least think that you need therapy, this is sort of giving you more insight into how you can make use of it, or if therapy is for you. Right. So I really hope that you are able to take something back from this conversation. We'll just wait for a minute or two. I'll send her a request again and she'll join back. So just hold on for a minute or two. Don't click away. Yeah, Rajeshwari.
Hi, sorry, I ran out of the chat.
That's okay. I think our audience is loving this conversation a lot. They are able to get a lot of insight. So I think your answers or what you're saying has been really helpful for the audience. So thank you so much for that.
Thank you, Rohit, for this wonderful opportunity as well.
So like I wanna take up a question that's come up from our chat, which is therapy addictive? That's an interesting question. Do you think therapy is addictive? Because I haven't really been to a therapy session, so I don't know how they work as such. Rajeshwari, are you there? Okay.
Hi, sorry, I again got lost. Could you just repeat the question? I'm so sorry.
That's okay. That's okay. No problem. So the question is therapy addictive? So I don't really know how therapy is like. So I don't know if I can really put any context to that. But what are your thoughts on that? Is therapy addictive?
So sometimes what happens is there is a dependent relationship because it's seen like, the therapist is looked up towards as, probably a problem solver or someone who is there by their times, of struggle. So it can be a dependent relationship, but usually a therapist will realize that. It can even go the other way, where, the therapist wants to keep the client coming because, they think like, what if something happens? And there are a lot of follow-up sessions. So usually in this process, to avoid all these things, what therapists usually do is you have a long-term therapy, and once your major goal or issue is resolved, then you start having just follow-up sessions. The number of sessions per week, per month reduces.
Okay.
So that's how you start kind of weaning off from sessions.
Okay.
So yes, it does happen that the client can get dependent.
Okay, got it. So how many in terms of course these are based again on subjective terms, personal requirements and stuff, but in general, or is there an average number of therapy sessions that one person needs to attend, or is it again sort of depending on just personal experience? Can one person be done in just say 2 to 3 to 4 sessions? Or do they necessarily need to go for like 10 to 15 to 20 sessions to be able to actually get anything out of it?
All right. So, am I audible?
Yeah.
I just got disconnected a little in between. Yeah, sorry. Yeah. So, there is no fixed number of sessions. With respect to, as I said earlier, crisis management or suicide intervention, It is quite short, and if it is going to be a skill training related session, then it is going to be shorter, couple of months maybe. But usually therapy is long term. You can even expect a year, and yeah, it basically depends on the client. And sometimes, even though therapy goes on for years, the number of sessions per week or month can reduce.
Okay.
So
Right.
there is no fixed number.
Right. Okay. With this, I think we have covered almost all the topics. If anyone who's watching this has missed our conversation, this is also live streaming on our YouTube channel. So if you want to go check out more or check out the earlier parts of it, you can basically go to our YouTube channel and watch the whole thing. Right. So thank you so much, Rajeshwari. Thank you so much for talking to us. And again, for whoever's watching this, Rajeshwari is organizing CoWinCon, which is basically a conference which is happening this Saturday from 6 to 8 p.m., where she will have 7 professionals from both physical and mental health perspectives, who will be coming and talking in depth about their experience in terms of how people can deal with COVID and different aspects of their expertise. So, Rajeshwari, you could expand a little bit more on the conference.
Hi, Rohit. So I think I'm getting cut off a lot because it's my campus Wi-Fi, but I'll try to explain it as quickly as possible about what I'm basically. Yeah. So technically, we are working with an expert panel who has worked closely with COVID or individuals or COVID related fields, like for example, in the medical field of biomedical research with vaccines and genomics, and also mental health field, as we discussed today a lot on mental health, and physical health as well, because that is a very, very important aspect. So CoWinCon is in a holistic way covering how to deal with COVID and providing reliable information, which I think is one of the major ways of fighting this second wave.
Right. Thank you so much, Rajeshwari. Thank you so much for sharing all those valuable insights. I'm sure this conversation is going to be very helpful to not just those who have watched till now, but people who will go back and watch it again. So thank you so much for doing this for us. And guys, please make sure that you attend the CoWinCon on Saturday from 6 to 8 p.m. There is a registration link in the bio if you want to join the Zoom link. We will also be live streaming it on YouTube in case you miss it or you want to watch it, not join the Zoom call and just watch it on YouTube. So you can do that as well, right? So please make sure you join us on Saturday. Thank you so much, Rajeshwari. Okay, I think she got cut off again. So I'm going to end the conversation here. If anyone who's missed the conversation, please go back to YouTube and watch the whole thing. And yes, don't forget Saturday, 6 to 8